Hello everyone, welcome to new video on preclinical pharmacology. Today in this lecture we will discuss about segment first study of reproductive toxicology. In last video we have seen the reproductive toxicology and its introduction. Today in this lecture we will focus on details about segment first, that is general fertility and reproductive performance. Reproductive mammalian cycle is mostly divided in three segments, that is segment first, segment second and segment third. The reproductive mammalian cycle starts from sexual maturation, production and release of gametes, fertilization, transport of zygote, implantation, embryogenesis, fetal development, parturition, lactation and postnatal development, development and growth. In segment first, mostly start from production and release of gametes to the implantation. General requirement. Animal, rat. Prefer rodent species male and female. Drug administration to both 28 days in male and 14 days in female. Drug treatment should be continued before mating, during mating and subsequently during gestation period. Housing and feeding. Temperature not exceed 22 degrees Celsius to plus minus 3 degrees Celsius. 12 hours light and 12 hours dark cycle should be followed. Feeding laboratory diet used with ultimated supply of water. Not more than 5 animals housed per cage. Pregnant and lactating female should be housed in separate cage. Procedure. Male and female rats. Drug are administered 2 weeks prior to mating, during mating period, and until implantation, that is, day 6 postpartum of rat, before 28 days to male rat, and before 14 days to female rat. 3 graded dose up to maximum tolerated dose should be selected. Route of drug administration should be same. 15 males and 15 females should be placed in each group. Same number of rats in control and test. Dam allowed to litter and medication to female rat should be continued till weaning of pups. Animals are sacrificed submitted to the caesarean section at mid-pregnancy and reproduction parameter and embryo status recorded. Observational parameter. Examination of estrous cycle. Stages of estrous cycle and detecting spermatozoa are achieved by examining vaginal smear. Separate video is uploaded that how to examine vaginal smear. Link is given below. Evolution parameter of female rat. Evolution phase of stage A and stage B process standard parameter, additional parameter. Female effect on estrous cycle, tubule transport, implantation and development of prime plantation of embryo. Standard parameter. Clinical signs and mortalities at least once daily, body weight and body weight change twice in weekly, food intake at least once weekly except during mating, recording vaginal smear daily at least during mating period, to determine whether there is effect on mating or precoital time. Additional parameter. Monitoring estrous cycle during pre-mating period. Specific clinical observation related to the sexual behavior. Assessment of observational parameter, that is mature embryo implantation action of gametes, mating behavior, fertility, prime plantation stage of implantation. Standard parameter. Observation that have proved in toxicity study, necroscopic, microscopic examination of all adult, preserve the organ with microscopic finding for possible histological evolution. Evolution parameter for male rat. Evolution phase of stage A and stage B process, standard parameter. Additional parameter. Male. Detection of function effects that may not be detected by histological examination of male reproductive organs, that is libido, epididymal sperm, maturation. Standard parameter. Clinical signs and mortalities at least once daily, body weight and body weight change twice in weekly, food intake at least once weekly except during meeting, observation that have proved of value of other toxicity study, preserve the organ for microscopic finding for possible histological evolution. Keep the corresponding organ for sufficient control for compression. Additional parameter. Specific clinical observation related to the sexual behavior, abnormal sperm form. Assessment of observational parameter, that is maturation of gametes, mating behavior, fertility. Standard parameter. Preserve the testes and epididymis for all animal for possible histological evolution and case-by-case basis. Thank you.